Hi, my name is Sarah Caswell. I'm a physician assistant at the University Surgical Oncology Group at the University of Tennessee. Today we're going to go over the care for your JP drain that you received after your surgical procedure. To start, we're going to go over your drain kit that you should receive before going home from the hospital. This kit includes a measuring cup, gloves, and 2 waist belts. The first component we'll go over is the waist belt. The waist belt is important so that your drain does not hang without support. To put on your waist belt, you wrap it around and you secure it using the Velcro. If you have belt loops, you can also have added security by securing it to your belt loops. The pocket here is designed to drop your drain bulb in and secure with the Velcro. If you are uncomfortable wearing it around your waist, you can wear it as a necklace, and you can secure it using the same method that you would as a waist belt. However, something that's important to keep in mind that if you're going to wear your drain belt as a necklace, your bulb has to be located lower than where it comes out of your skin. I recommend keeping one waist belt for the shower, as you do need to make sure that your drain stays supported even in the shower. So you can treat the waist belt just like a towel and let it dry. The next part are the gloves. Before doing anything with your drain, it is important that you wash your hands and wear gloves. However, for this demonstration, I'm going to do it without gloves so that it's easier for you to see the steps of the procedure. So to move on to stripping your drain, this process needs to be done 2 to 3 times a day depending on the recommendations from your surgeon. To strip your drains, you'll take whichever hand you're most comfortable with. Most people, it is with their non-dominant hand. You will pinch as close as you can to the black stitch seen here. Then you will pinch below your hand closest to the black stitch and milk down the tubing. If you would like to step your fingers down the tube drain, you make sure to have your hand furthest away from the body pinched at all times so that you do not lose suction. And then you would continue to work your way down the tubing, keeping one hand pinched on the tubing at all times. And you continue this process all the way down the tubing to the drain bulb. Sometimes, if you have a clog or a clot, you might have to do this stripping procedure more than once for every time you do it throughout the day. So it's important to maintain a record of the output of your drain, and you'll measure the drain output every time you strip the drain. So to do so, you'll take your measuring cup that you received in your drain kit, and we'll use the milliliter side of the measuring cup to record your drain output. So to record your drain, you remove the stop top, you leave your tubing connected, and then you dump the contents of your drain into the cup. Before putting the top on, you want to make sure you squeeze all the air out of your drain bulb using the palm of your hand, and then put the top back on. It's important to get all the air out of the drain bulb itself so that you maintain the vacuum nature of your drain. Essentially, it should look as if you could sit a tennis ball in your drain bulb. To record the content of your drain, it's important to have it on a flat surface. You would look at the milliliter side of your drain and then record that amount on a log or a chart, whichever is provided by your physician. So for our example, our drain was at 20 milliliters. Now that we've gone over how to strip your drain, we're now going to move on to the care of your drain site. As we've discussed earlier, you can shower with your drain. It's important when you shower to make sure that you allow soap and water to run gently over the drain site. It is important, though, not to scrub vigorously around the drain site, as this can cause irritation. If there's one day that you're unable to take a shower, it's important to make sure that you take a soft washcloth and gently clean around the drain site to avoid any accumulation of dirt or bacteria around the drain site. Once your drain site is clean, it's then time to dress your drain. To dress your drain, you'll take 2 pieces of 4x4 gauze and fold them in half. You'll place this between your skin and the drain tubing. Once that's in place, you'll take 2 more pieces of 4x4 gauze and place that on top of the drain exit site and the tubing. To secure this dressing, you'll use Me-Fix tape and secure it like so. It is important to note that if you're going to dress your drain as shown, to change this dressing every day regardless of if you shower.
So now we'll go over the signs and symptoms you need to be aware of going home with your new JP drain. First, we'll start off with fevers over 100.5, chills, sudden changes in your appetite, your pain level, energy level, or mental status, increased redness or swelling around the drain site or incisions. It's important to note that it is normal for there to be some redness around your drain site. However, anything greater than about a quarter-sized coin in diameter is a reason to call your physician. Dramatic changes, either increasing or decreasing in your drainage output, foul-smelling yellow or green drainage in your bulb. Keep in mind the normal progression of your drain output should go from a red blood color to a light pink to more of a clear color. Again, any deviation in this progression of color would be a phone call to your physician. Drainage from the incision itself. All drainage should be going directly into your drain bulb. Increased leakage of fluid around the drain site. This would be recognizable by increased dressing changes or your dressings feeling soaked. If your drain seems clogged or there's fluid building up under your surgical incision, or if your drain comes loose, the stitch comes loose, or your drain falls out. If you have a life-threatening emergency, go to your nearest emergency room.